Imagine your brain as a sprawling, vibrant city, a metropolis of thought and activity. It's a place where ideas are born, memories are stored, and every single action is coordinated. This incredible city is powered by an intricate network of blood vessels, its lifeline, its essential infrastructure. These vessels, like highways and byways, constantly deliver oxygen and vital nutrients to every neighborhood, every street corner of your brain. They are the unsung heroes that keep everything running smoothly. Now, imagine a sudden disruption to this vital supply line. A stroke happens when one of these critical vessels is blocked by a clot, preventing blood from flowing through, or bursts, causing a hemorrhage. Either way, the result is the same: a sudden cutting off of blood flow to a specific part of the brain. This deprivation of blood is what causes the damage. Without a constant supply of oxygen, brain cells, which are incredibly sensitive, begin to die within minutes. Time is brain. Every second counts, and the faster medical intervention is received, the better the chances of recovery. The effects of a stroke are highly variable and depend entirely on which specific area of the brain is affected, impacting movement, potentially causing weakness or paralysis, speech, leading to difficulty finding words or understanding language, memory, causing confusion and difficulty remembering recent events, or even emotion, leading to mood swings or difficulty controlling feelings. All of these functions can be significantly affected. It's like a sudden blackout in a neighborhood. Everything stops working in that specific area. The lights go out, the appliances shut down, and communication is disrupted. Recognizing the signs of a stroke quickly and acting fast is absolutely crucial to restoring power to the affected area and minimizing long-term damage. The quicker the intervention, the better the outcome. Strokes can strike anyone, regardless of background, at any age. It's a misconception that they only affect the elderly. Younger individuals are also susceptible. Therefore, understanding what's happening inside your head, knowing the risk factors, and recognizing the warning signs is the first and most important step towards prevention and ensuring quick action if a stroke occurs. A stroke is essentially a plumbing problem in the body's most vital and complex organ, the brain. And just like with any plumbing emergency, fast action can save a life. When we talk about strokes, it's important to understand that not all strokes are the same. In fact, there are two main types of stroke, each with its own unique cause and requiring a different approach to treatment. Understanding the distinction between these types is crucial for effective medical intervention. These two main types are ischemic and hemorrhagic. They represent fundamentally different problems within the brain's blood supply. Ischemic strokes, which are by far the most common type of stroke, accounting for a significant majority of cases, happen when a blood vessel supplying blood to the brain is blocked, usually by a blood clot. This blockage deprives brain cells of the oxygen and nutrients they need to survive. Think of it as a traffic jam in the brain, where the flow of blood is completely stopped or severely restricted, preventing vital resources from reaching their destination. These clots can form within narrowed arteries in the brain, a process often linked to conditions like atherosclerosis, or they can travel from other parts of the body, most commonly the heart, and lodge themselves in a brain artery. Hemorrhagic strokes, on the other hand, are caused by a blood vessel in the brain rupturing or bursting, flooding the surrounding brain tissue with blood. This excess blood puts pressure on the brain and disrupts its normal function, leading to increased intracranial pressure. Conditions like uncontrolled high blood pressure and aneurysms, which are weak spots in blood vessel walls, are among the most common causes of hemorrhagic strokes, increasing the risk of vessel rupture. So, to recap, ischemic stroke is due to a blockage, preventing blood flow, while hemorrhagic stroke is due to bleeding, causing blood to leak into the brain. Despite their different causes, both types of stroke are medical emergencies that require immediate attention. The symptoms of ischemic and hemorrhagic strokes can look very similar, making it difficult to distinguish between them without medical imaging. Because the symptoms overlap, you should never try to guess which type of stroke someone is having. Instead, call for emergency medical help immediately if you suspect someone is having a stroke. Once the patient arrives at the hospital, a CT scan or other brain imaging technique is performed to reveal the specific type of stroke. This accurate diagnosis is crucial, as it guides the medical team in determining the most appropriate course of treatment. For example, clot-busting drugs, also known as thrombolytics, are highly effective in treating ischemic strokes by dissolving the clot and restoring blood flow. However, administering these same clot-busting drugs to a patient experiencing a hemorrhagic stroke would be extremely dangerous and could worsen the bleeding. Therefore, fast and accurate diagnosis is absolutely critical in stroke care, ensuring that patients receive the right treatment as quickly as possible. In the treatment of stroke, every second counts, and the sooner treatment begins, the better the chances of a positive outcome. The best tool against stroke is knowing how to spot it. Use the FAST test. F. Face drooping. Ask the person to smile. Does one side droop? A. Arm weakness. Ask them to raise both arms. Does one drift down? S. Speech difficulty. Ask them to repeat a simple sentence. Is their speech slurred or strange? T. Time to call emergency services. Don't wait. These signs appear suddenly and are easy to check. If you see any of them, call 911 immediately. Note the time symptoms started. This helps doctors decide on treatment. Quick action can save brain cells and lives. FAST is simple, memorable, and can make all the difference. Share it with everyone you know. Many strokes are the result of years of hidden risks. Some factors like age, family history, and race can't be changed, but knowing them helps you stay alert. The biggest controllable risk is high blood pressure, the silent killer. Smoking, poor diet, and lack of exercise all raise your risk by damaging blood vessels and increasing clotting. Conditions like atrial fibrillation and diabetes also make strokes more likely. Managing blood pressure, quitting smoking, eating well, and staying active are powerful ways to lower your risk. Work with your doctor to control medical conditions. Prevention starts with understanding what you can change. Did you know that up to 80% of strokes are preventable? That's right, a significant portion of strokes can be avoided by making conscious and healthy choices every day. Understanding this potential for prevention is the first step in taking control of your health. One of the most impactful changes you can make is to embrace a diet rich in fruits and vegetables. Incorporate whole grains and lean proteins into your meals. At the same time, actively cut back on your intake of salt and unhealthy fats, which can contribute to high blood pressure and cholesterol levels. Aim to get at least 150 minutes of moderate intensity exercise each week. This doesn't have to be strenuous. Just 20 minutes a day of brisk walking or cycling can make a significant difference in your cardiovascular health and overall well-being. It's also crucial to maintain a healthy weight. Excess weight puts unnecessary strain on your heart and blood vessels, increasing your risk of stroke and other cardiovascular diseases. If you smoke, quitting is the single best thing you can do for your health. The positive effects on your body begin almost immediately after you stop smoking, significantly reducing your stroke risk. It's also important to limit alcohol consumption and actively manage stress through relaxation techniques or hobbies. Regularly monitor your blood pressure, cholesterol levels, and blood sugar. Work closely with your doctor to keep these vital health indicators in check and within a healthy range. Remember, stroke prevention is a daily commitment, requiring consistent effort and healthy habits, not just a one-time fix. These small changes, when practiced consistently, add up to significant protection for your brain and overall health. So, take charge of your health today. Your future self will undoubtedly thank you for the proactive steps you're taking now to ensure a healthier and happier life. In a stroke emergency, every minute matters. Time is brain. If you spot stroke signs, call 911 immediately. Don't drive the person yourself. Paramedics start treatment on the way and alert the hospital to prepare. At the hospital, a rapid CT scan determines the stroke type. For ischemic strokes, clot-busting drugs or procedures can restore blood flow if given quickly. For hemorrhagic strokes, doctors focus on stopping the bleeding and reducing pressure. The faster treatment begins, the better the chances of recovery. Your quick call sets the life-saving chain in motion. Don't hesitate. Act fast and save a life. Surviving a stroke is just the beginning of a long journey. Remember that the road to recovery is unique for everyone, with its own set of challenges. The brain has an amazing ability to adapt and heal, but it takes time, dedicated effort, and unwavering support. Rehabilitation often starts early, with a dedicated team helping regain movement, speech, and essential daily skills. Emotional recovery is also just as important, and support from loved ones and skilled professionals truly makes a big difference. Progress may seem slow at times, but remember that every small step truly counts. Many stroke survivors go on to lead fulfilling and meaningful lives. Hope, unwavering patience, and strong determination are key. With the right help and resources, a new future is indeed possible, one step at a time.